Welcome to Medical Group e-learning. This is Hafsa Mobeen from FMDC and we are doing Journal Anatomy. This is chapter 5. First of all, TOS represents there will be 1 SCQ and 7 MCQs from hold this book in your paper. This is about muscles and this first para is not important. Functions of muscles are just for your reading. You need to read this topic. The types of muscular tissues is important. It is asked in your SCQ. And this is explanation of different types of the muscular tissues. First is skeletal muscle, and highlighted points are important for your MCQs. Smooth muscles, and this is important for your MCQs. And next is the skeletal muscle fibers. Fibers are important. You need to know these points for your MCQs, and these are different types of muscle fibers. This is very important SCQ and it has been passed to UQ, so do this topic well. This is the explanation of the fibers. Next is the connective tissue associated with skeletal muscles, the fascia. Just read this topic, important for your understanding. Deep fascia, and important highlighted text is important for your MCQs. You need to know the definition of retinacula. This is important. And just read this paragraph and do the definition of tendon. From here, you have to know the definition of aponeurosis. What are different parts of a muscle? Just read this. You just have to read this. These definitions and explanation of different structures of the muscle are important for you SCQ, and this is past UQ. The tendon insertion is just for your reading. This is again continuation. Lubricating mechanisms are important in respect with your MCQ points. Synovial sheath is again important SCQ definition. Classification of skeletal muscles is important for your SCQ. You need to know all the classification of the muscles. This is all classification. Multipinnate and what are the pinnate muscles and their types. It is an individual SCQ in the classification. So do all the classification well. This is different type of classification based on the group action. Agonist, antagonist, and synergist. This is the diagram showing different shapes. All about the classification. Now the naming of muscles is important for your MCQs. This is important for your MCQs. And blood supply, just read this topic. Just read the nerve supply. These are not important. You can leave this or just read this. Motor unit is important for your MCQs. Contraction. These are different types of contraction which is very important as your SCQ. This is the important topic for your SCQ. Muscle paralysis, just read this. And spasm and strain of the muscle is important for your SCQ. Next is chapter 6. This is about circulatory system. First topic is just for your reading. Just read this page. This is important MCQ point. Again MCQ point. All are the MCQ points in this page as well. Next page, the heart, just read this. Blood vessels are just read this from here. The classification of blood vessels is important for your SCQ. These are important MCQ points. First is the anatomical classification. This is important for your SCQ. You have to name the elastic arteries. Which are the elastic arteries? Just do the highlighted text. What are the muscular arteries and their examples? What are the arterioles and what are their examples? So you have to do this for your MCQs as well. What are the capillaries? Do all the classification of the vessels. Types of capillaries is specifically very important topic for your SCQ. You have to do this very well. The sinusoidal capillary is the third type. This is again very important topic. After arteriole, there are venules, and this is important for your MCQs. What are preferential channels? This is important MCQ point. What are the veins? You have to do the important highlighted text just for your SEQ, the classification. Next is this functional classification. Just read this. You have to read this important names. Just now is the next topic, which is anastomosis. Anastomosis is important. First is the arterial anastomosis. You need to know different types of anastomosis. This is very important. SEQ. This is a venous anastomosis, again important, and arteriovenous, again important for your SEQ. Glomus bodies important for your MCQ. Now are the circulatory routes. Just read this. You already know all of the text. Just read the whole topic and important MCQ points. This is again continuation of that topic. Just read this. Portal systems are important for your SEQ. You have to define and elaborate different types. First is the venous portal system. You need to know the examples. And next is the arterial portal system. You need to know the examples. What is the vascular supply of blood vessels? Vasa vasorum is important for your MCQ. Lymphatic system is important. First read this topic from that page, and upcoming text is important for your SEQ. The lymphatic, how is the lymph formation occurs and circulation. So this is important, the lymphatic vessels, and they're all routes of the lymph. Next is the role in the spread of infection and cancer of the lymph nodes or the lymphatic system. This is important SEQ. And third important SEQ is the components of the lymphatic system. So you need to do this lymphatic system quite well. That's all about this chapter. Stay tuned for more videos.
Medical Globe introduces its series of successful publications, MBBS Cracks, the benchmark of all, containing all the chapter-wise questions of prime importance, all annual and supply solved university questions, questions to ace your vivas, chapter polls, and of course, we have incorporated all the labeled and histologic and anatomic models in high resolution for your distinction level OSCE preparations. Medical Globe has also launched a gem in the medical world to master every concept for your multiple choice questions, the MCQ cracks encompassing UHS, NAMS, and many others, revealing the UHS MCQ rank, your practice MCQs, and topic-wise MCQs. Get your MCQ and the MBBS cracks at your doorstep by placing your order at 0335 66 33007.